Today we are going to talk about how to use the foam roller to get some muscle relief from trigger points, from soft tissue restrictions, or from general tightness. My name is Dr. Jeanette DeWitt. I am a doctor of physical therapy, a certified athletic trainer, a certified personal trainer, and a certified precision neuromuscular therapist. And one of the big reasons I wanted to demonstrate the foam roller is because so many people think that the foam roller hurts. It is firm, it is rigid, and I actually used to hate the foam roller, but it is a very, very good tool in helping to release trigger points in your body, especially on some of those big muscles. For example, if we take a look at muscle tissue and you have a muscle that is normal length like this. This is great. That muscle can contract, it can relax, it can contract and relax normally, so you are more efficient with your movement. But if you have a trigger point and the muscle is shortened, it's already in a contracted, shortened state. So sometimes that comes across as weakness. When you're really not weak, you just have a muscle restriction. The only way to release that is through physical intervention. That could be through hands-on therapy with a professional like myself, or you can use a tool like a tennis ball, the stick, or the foam roller, which is what I'm going to show you today. So if you have this trigger point and your muscle is kind of bunched up or knotted and restricted, when your muscle tries to do work and shortens to contract more, it doesn't have very far to go, and that makes it inefficient. When that trigger point is released, it can actually go back to its normal length and contract, relax, relax. One of the best times to do the foam roller or to use it is going to be before a workout or before stretching, because if you try to do work and your muscles are restricted, you won't be as efficient. You won't be able to generate as much force or power to do the work as in lifting weights, running fast, jumping, and the like, okay? The same rules apply if you're trying to stretch. If you're trying to stretch and your muscle is restricted, you can't elongate that muscle because you are physically impaired to do so because the trigger point is in the way. When that trigger point is released, now the muscle can relax and you can get the better benefits of stretching, which will help improve your flexibility and mobility. So one of the things that I like to do is just start with the quadriceps muscles. So I do recommend being on the floor versus the bed because you do need a firmer surface. So you kind of get into a plank position and you roll across your quadriceps muscles. Now right now you're just exploring. You're finding out areas that are sore. When you come to an area that maybe is more sore, then you want to hang out there. Now how long should you hold that? At least 30 seconds. It takes your brain 30 seconds to tell the muscle to relax. So you want to at least hold for 30 seconds, but you can hold for up to 2 minutes. I recommend hanging out on areas that are more tender because that is what is known as an active trigger point. An active trigger point is going to be an area that reproduces your symptoms. A latent trigger point is going to be an area that's tender but does not reproduce your symptoms. It is okay to work both areas because when you release an active trigger point, it will release and relieve the symptoms that it is causing. When you relieve a latent trigger point, you are also causing the muscle to relax. The interesting thing is that latent trigger points, even though you may not know that they're tender until you press on them or apply pressure to them, cumulatively, if you have a lot of latent trigger points, those can wreak a lot of havoc on your muscle tissue. So you want to try and work on both of those. So let's just go through a routine here. So I'm coming across the quadriceps. Then I'm going to go more onto the side or the lateral outside portion of the quadriceps. And I'm going to do the other side as well. Again, if I come across a point that's really tender, I'm going to hang out there for about 2 minutes or at least 30 seconds. Now I can go more to the side and get the IT band. And then I can switch and get that other side. And I recommend at least like 10 to 20 strokes on each side, or sustaining the pressure on a tender area for at least 30 seconds. So I'm going to go and finish up with the quadriceps and the IT bands, and then I'm going to go to my calf muscles. So I'm going to get my feet are in a neutral position, and then I'm going to turn my feet out so I can get more of the outer portion of the calf and the lower leg. And then I'm going to turn my feet in. This is a good upper body workout, by the way. Good core workout, too. And so now I have my lower legs. Excuse me. Then I'm going to get my hamstrings. So I get the back of the legs, or the thighs. I rotate my feet out again, because now I can get the outer hamstring, the biceps femoris muscle, and then I can rotate my feet in and get more of the inner hamstrings, the semimembranosus, the semitendinosus. Okay, and then if I want to get more of the inner thigh, I can come in through here. Just be careful on the inner thigh, because there is a nerve that runs more superficial or surface, and you really don't want to be pressing on that. So if you do experience any tingling or numbness, you want to back off on your pressure and stay away from that. So same thing here on the opposite side, getting that inner thigh area. Okay, now we'll look at the gluteal muscles. So you kind of sit on here and then work on the piriformis and the gluteus medius, gluteus minimus, gluteus maximus. And this area can be pretty tender. So you might end up saying, oh, that feels a little sore there. And you might hang out there for 30 seconds to 2 minutes. Okay, for the sake of time, I'm going to keep going, even though I feel a little bit of tenderness there. Okay, and we'll switch to the other side. Now keep in mind, when you are rolling, you want to stay off of bony areas. You want to just be on soft tissue and fleshy areas. So we don't want to be on bony areas. It's painful that way. Okay, so now we go to the low back area. And kind of do a little bit of a bridge. And on here, you will go across the spine a little bit. Keep your chin tucked, your abdominals nice and tight. And then you can kind of get more onto the one side versus the other. You're working the iliocostalis lumborum and the quadratus lumborum. Okay. And then come to the opposite side. So you're getting some abdominal work in here as well. You can put your hands down to help if you need to. But use your feet and your legs to kind of help roll you. Okay? And
And then you can get into the middle. Now, you will be along the spine, but you do have muscle there. So just be careful with this as you roll through. And if you feel like pops and cracks in your spine, do not be alarmed by that, because you're also, at this point, not only working the muscle, but you could be creating some kind of self-mobilizations along the spinal segments. That's not a bad thing. If you experience pain, you want to stop. You can support your head here a little bit as well. And notice I'm working in short, small strokes so that I can have control and maintain control over the foam roller. And then I kind of work up into that mid-back area. And here I'm working more of the longissimus thoracis muscle, the iliocostalus thoracis muscle. And the reason I mention these names is I like you to know that this isn't just a general thing. We are actually working something specific. And those particular muscles, I call them the parentheses muscles of the back or of the spine, because they literally look like parentheses, and they're in layers of surface or superficial to middle layer to deep layers of erector spinae muscles. And these muscles can attach all the way from your pelvis up to the base of your skull. So if you're experiencing headaches, if you're experiencing neck tightness, it may not just be coming from the head and the neck. It could be because the muscles all the way from your pelvis that go up to the base of the skull may be creating some tightness and pulling issues along the vertebrae. So it's important to look and address all areas of the back and the spinal, as well as your pelvic alignment, because those can be influencers to the entire spine, the neck, and the head posture. Now I'm between the shoulder blades and up at the base of my neck, around the C7, T1 area. So, and here you can actually get a little more specific and go and emphasize one side of the body versus another. And again, you may feel, notice I have to keep positioning, you may feel some pops and cracks in your spine if the little joints called facet joints are tight as well. And those can get tight when the muscles are tight, because the muscles attach to those bony areas. Now, I'm not directly using the foam roller with the intention of targeting my spine, but my muscles are on each side of the spine. And so as I'm rolling the muscle tissue on each side of the spine, it can influence those individual spinal segments. So keep that in mind. Now, as you go and you're rolling, one of the nice things about the foam roller is you can hang out here and just let your body stretch and open up that chest area. And if you find that challenging to do, you probably need to do it a little bit more because it's tight across the chest area. So those are some basics with the foam roller. I hope that gives you a great place to start. You should not experience pain with the foam roller. If you experience soreness or tenderness, it should be around the level of a 30 or 40. So 0 being none and 100 being worst pain ever, like you actually went to the emergency department. This tenderness should be in a 30 to 40 range max. If it's more than that, then I would recommend doing something different than the foam roller to start with, such as a tennis ball self-massage or a massage stick self-massage. And I actually have videos for those
as well, so you can check those out. If you find this valuable, go ahead and make some comments below, and also share it out with people and pass it on. It's a little bit of a workout. You'll notice that I'm a little bit out of breath. You are working. You're working your core, you're working your upper body, you're working your legs depending on where you're foam rolling. So it's not a passive treatment by any means. You are engaging muscles and you are relaxing muscles by using the foam roller to release any restrictions or trigger points. I hope you find this valuable. Thanks a lot and have a great day.